How we can expect recovery at the age of 13 years in autism.
Sir, we have tried a lot many things. Kind of now the age of my child is 13 years. We have tried like multiple things, Ayurveda, homeopathy, allopathy, and Panchakarma as well. But what things you offer us, like how you are different from others, how we can believe?
It's understandable. See, it's very understandable when the age goes to 13 years, and when as a parent has tried a lot many things. Ayurveda, homeopathy, as you just mentioned, even Panchakarma you just mentioned, and maybe psychotherapy. You must have tried psychotherapy also. Did you go for it?
Yes.
OT, psychotherapy, speech therapy.
ABAs are going on regular 4 hours a week.
Yeah. So now these scenarios are pretty common with the children who are coming to us at an advanced age. Because see, when we talk about autism is not a disease which is automatically going to go away after a few years. So even after diagnosing it correctly and then going for various kinds of treatment, generally at the age of 12 years, 13 years, 14 years, when the child starts becoming adolescent, the hormonal changes occur in the child. Many a times the child will become more aggressive, and the parents then all of a sudden become even more willing to see a positive change in the child. But again, along with it, they don't have hope. They have already lost belief in any of the pathies, and that is pretty understandable. Because see, single-handedly, none of the known therapies or pathies are in themselves sufficient to bring a child out of autism. And that is why I did my own research. Had it already been a protocol of how to treat autistic kid, how to bring him out of the space, no research would have been required. So when I researched, what I realized was that on one hand, we need to give more support to the subconscious, because it basically is the subconscious which is working lesser in a child suffering from autism. And along with its lesser work, another thing which is hampering is that the child is not willing to make it work. So two things are combined. One, the will issue, another, the skill issue. So we need to be covering both of those. And that is what makes us different from others. So during my PhD, when I worked on autistic kids, when I worked on the children suffering from autism, what I did was, on one hand, I used Ayurvedic herbs which give nourishment to the subconscious mind, which make the subconscious mind work much better. Along with that, we create situations through applied behavior application where the child has to show those behavior patterns which we are willing for the child to show. We work on each behavior pattern. We study the behavior of the child through a large, highly talented psychotherapy team of ours. That team couples up with the Ayurvedic doctors. Particular herbs are chosen. So simultaneously to the administration of herbs, we are using APA. When both those things are done in tandem, it is then that the real difference starts. So difference cannot come with Ayurveda. Difference cannot come with Panchakarma. Difference cannot come with psychotherapy. But a huge difference comes once these are collectively used in tandem in a special pattern. And that is what we have been doing since past 23 years now. So don't worry. It is understandable. You must have lost hope. It would be tough for you to believe that things are going to work. But once you start believing, you will start visualizing a lot of changes coming in his life.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma, and gift your child autism-free life.